welcome. Thank you all for joining us. We'll get just started here in a minute. See people trickling in. So yes, good afternoon and welcome. Thank you all for joining us for today's webinar, State Grants and School Medicaid, a new opportunity to advance school health services. My name is Allison Paxson, and I'm the Policy and Program Manager for the Healthy Schools campaign. I am so honored to have the pleasure of kicking off today's webinar. We'll be diving into an exciting new funding opportunity from the Centers for Medicare and Medicaid Services, $50 million in state grants to help connect millions more children to essential school health services, including much needed mental health care. This marks a critical opportunity for states to advance school health and support students and school communities to thrive. So now, before I get into today's agenda, I want to mention a few housekeeping items and reminders. First, this webinar is being recorded, and we will email the recording and slides and any additional resources out to you after the webinar. At the end of today's presentations, we'll also have time for Q&A. So as a reminder, you can submit your questions to our speakers using the Q&A box, or share questions or comments to our panelists or all participants using the chat feature. We'll do our best to answer all questions, but if we don't get to yours today, we'll be following up with you after the webinar. And so for those of you who may be unfamiliar with the Healthy Schools Campaign, or HSC, we are a national organization working at the intersection of education, health, and equity. We are based in Chicago, and we are a leader in advocating for sufficient and sustainable funding for school health services, including through Medicaid. And so with that, I will now turn to today's agenda and briefly introduce our speakers. First, we'll start with a brief background presentation on school Medicaid from my colleague, Jessie Mandel, who is the Director of National Policy with HSC. Then we're thrilled to welcome Lydia Briggs, the Health Insurance Specialist in the Division of Reimbursement Policy, and also in the same division, Andrew Badaracco, Deputy Director of the Division of Reimbursement Policy with the Centers for Medicare and Medicaid Services, or CMS, who will provide an overview of the new state grant opportunity. From there, we'll be hearing from Laura Guerra-Cardis, the Director of State Medicaid Strategy with the Center on Budget and Policy and Priorities, who will discuss the key role that advocates can play in making a difference in school Medicaid policy and ways advocates can build bridges across sectors and engage with their state agencies. Laura's remarks will be followed by presentations from two state policy experts, Jen Griffiths, the Vice President of Policy and Advocacy with the Alaska Children's Trust, and Emily Beauregard, who is Executive Director of Kentucky Voices for Health. Jen will be sharing with us how her organization and partners are actively building momentum for investments in school health in Alaska, and then Emily will give an overview of their efforts in the state of Kentucky to successfully build a broad coalition of support for school Medicaid. To wrap things up, we'll end with a final Q&A session. So again, thank you all for being here today. We're so excited to hear more about this new grant opportunity and how these grants can be used to implement, enhance, and expand Medicaid-funded school health services. So with that, I'll hand things over to my colleague, Jessie Mandel.
Thank you so much, Allison. I'm thrilled to be here. So I'm going to start things off by sharing a little background for those of you who are just getting familiar with the school Medicaid program and why this grant opportunity really caps off a new era for school Medicaid. To begin, next slide, we want to stress the importance of school-based health services overall. School health services are critical to advancing equity, improving access, and reducing the disparities and barriers to healthcare many students face. School-based health services are linked to reduced absenteeism, as well as better health and academic outcomes, both in the short and long term. But there are different models of delivering health services in schools. Some schools partner with community-based providers or host mobile vans. Some schools operate a school-based health center with a clinic located in or near a school. And some schools use telehealth as a modality to deliver school health services. But when we talk about the school Medicaid program, we are focused on providers who are employed by or contracted by the district to deliver services in a school setting. All models of delivering or financing services in schools are so important, but our focus today will be on school employed providers, and this is where Medicaid plays an especially unique role. At a high level, Medicaid, a very high level, Medicaid is a health insurance program for 1 in 5 people in the United States. Medicaid, together with its sister program, the Children's Health Insurance Program, or CHIP, covers nearly half of all children in the US and guarantees children comprehensive coverage for all medically necessary services. A key feature of the Medicaid program is that the total cost of the program is shared between federal Medicaid and states. States have the flexibility to design their Medicaid programs, and then CMS must sign off on the program. Each program is governed by a state plan, a written document that is approved by CMS, and changes to a state Medicaid's program are made through state plan amendments referred to as a SPA. Now, for over 30 years, Medicaid has paid for eligible school health services included in a student's individualized education program, or IEP, or an individualized family service plan, or IFSP. While Medicaid spending on school-based health services represents less than 1% of total Medicaid spending, it's a significant source of funding for schools. But historically, Medicaid would only reimburse schools for services provided to a limited number of students, those with IEPs. Then in 2014, CMS made a policy clarification that schools can be reimbursed for services provided to all Medicaid enrolled students. So now all states have the option to receive reimbursement for services delivered to all Medicaid enrolled students in schools. Medicaid can pay for school-based health services if the student is enrolled in Medicaid, services provided are covered by the state, services are delivered by a qualified provider, and states have appropriate billing, documentation, and oversight mechanisms in place. But it's up to states to decide to expand and take on this option. But at its core, expanding school Medicaid to more students can mean an increase in the amount of federal funding to the state to support school-based health. It can be a significant and sustainable new source of revenue to help schools stretch their health budget further. And more than that, this opportunity allows state Medicaid education and education policymakers to think more holistically about meeting student need. They can consider adding more services in schools, supporting the workforce. Additional Medicaid funding can make that possible. So now let's look at which states have taken up this option. This map represents all the states that have expanded their school Medicaid programs or partially expanded according to HSC's recent analysis. So according to our recent analysis, 25 states have expanded or partially expanded their school Medicaid program. Now, this map doesn't capture all the activity happening in states. There's momentum happening for school Medicaid across states, so we expect many more states to be turning green soon. But as we will be discussing today, every single state has the opportunity to enhance, refine, or improve their programs, even those states that are green now. In the last several years, we really have seen greater attention to the importance of student health services, especially mental health services, and the role of school Medicaid. And many states used their one-time COVID relief, or ESSER dollars, to invest in school health services and mental health services. But when we think about this momentum for school Medicaid, the biggest game changer for school Medicaid were some key provisions in the Bipartisan Safer Communities Act, which was passed in June 2022. The act called on CMS to issue updates and clarifications to its existing school Medicaid guidance for states, and this new guidance came out in May of last year. It called for CMS to establish a technical assistance center, and what brings us to our discussion today, to issue grants to states to expand or strengthen their school Medicaid programs. The new guidance really gives us a roadmap when we think about the grant opportunity and the school Medicaid program overall. This guidance paves the way for greater advancement and innovation, and it encourages all states to take up new options and flexibilities to reduce the administrative burden of the school Medicaid program. The guidance encourages all states to expand school Medicaid to all students beyond those covered by an IEP or IFSP. It encourages all states to cover all medically necessary services, cover a wide array of healthcare providers, and work toward greater collaboration and communication across state agencies. And since for most states, this new guidance will mean an amendment to its state plan, CMS has expressed a clear commitment to work with states to update and expand. which brings us to the new grant opportunity today. So I'll turn it over to CMS in just a moment, but this is an incredibly exciting opportunity, and it really cements this new era we're in for school Medicaid and the potential of education and Medicaid to work together for student health and well-being. Grants will be awarded to states to expand, implement, or enhance their school Medicaid program, and applications are due March 25th. While Medicaid will submit the application, state education agencies are a required partner, and partnership with school districts are strongly encouraged. But the bottom line here is that all states can and should apply. And that's why I'm so excited to have CMS here to join us, to give us more detail and information about this opportunity. So now I'm going to turn it over to Andrew Badaraco and Lydia Briggs with CMS to delve deeper into this grant opportunity, and then we'll have time for some questions too after their presentation. Thank you both for being here.
Thank you, Jesse. Thank you to the Healthy Schools Campaign for having us. We're really excited about this opportunity. There's been a lot of work that went into this program, as well as a number of different areas that as she highlighted in her presentation. So with that, I would love to turn it over to Lydia Briggs, who's a health insurance specialist on our staff and who worked very closely on our small team to put the notice of funding opportunity together. So with that, let me share my screen and I will turn it over to Lydia.
Perfect. Thank you so much. Good afternoon, everybody. My name is Lydia Briggs, and I am one of the members of the school-based service grant team. Today's presentation will be an overview of the grant, which we hope you will find helpful. So let's go ahead and get started. Next slide, please. So the key objectives that we want to cover during this presentation are to discuss the authorizing statute, including statutory language and purpose of the grants, discuss the parameters of the grant, including grant amounts, number of selected participants, and award timelines, describe the qualification requirements for submitted applications, including application categories and the selection process, provide you with information related to the specific due dates associated with this grant, including application submission and grant fund distribution, and also to provide you with the opportunity to ask questions at the end of this presentation. Next slide, please. So how did this grant come about? On June 25th, 2022, Congress passed the Bipartisan Safer Communities Act, which included Section 1103B, which stated, there is authorized to be appropriated $50 million for the fiscal year 2022 for the Secretary to award grants to states for the purpose of implementing, enhancing, or expanding the provision of assistance through school-based entities under Medicaid or CHIP. Next slide, please. In order to understand what that means, it's important to define some key terms. For the purpose of this grant award and relying upon existing work of the agency, CMS determined that it was necessary to define the following terms for this funding opportunity: implementing, enhancing, and expanding. Next slide, please. Implementation states are those who are at the beginning stages of school-based service program development. Implementing states are those that have yet to expand coverage and billing of Medicaid and CHIP services provided in schools beyond that what is provided pursuant to a student's individualized education program, or IEP. Please note that examples of these categories will be provided in later slides, so we'll get into that in a little bit more detail later on. Next slide, please. Enhancing states are those that further develop the coverage and billing of Medicaid and CHIP services provided in schools to include any Medicaid or CHIP covered services provided to a Medicaid or CHIP enrolled student, whether that service is provided pursuant to a student's IEP or under the federal free care policy, which means any allowable Medicaid service provided to any Medicaid or CHIP enrolled students that are medically appropriate to be provided in a school by qualified providers under the Medicaid or CHIP state plan. Next slide, please. Expanding states are those that have been expanded to have expanded coverage and billing of Medicaid and CHIP services provided in schools beyond that which is provided pursuant to a student's IEP, to include at least the expansion of one enrolled provider providing non-IEP services, such as a school nurse, or states that have expanded coverage in the school setting for at least one additional non-IEP Medicaid service under the Medicaid or CHIP state plan for any IEP or non-IEP Medicaid or CHIP enrolled student. As each state is applying for this grant, they will determine which category to apply under, either implementation, enhancement, or expansion. These three categories will inform the NOFO review process and acknowledge the different level of implementation across many of our state partners. So please keep this in mind as I go through this presentation, as it may help clarify which category best fits your state. Next slide, please. So on to award information. For this grant, there will be 20 awards given. Each award will total $2.5 million. I will explain the distribution breakdown of this later on in the presentation. As I explained previously, grants will be awarded based on 3 different categories: implementation, expansion, and enhancement. Based on these categories, no less than 10 grant awards have been designated for the implementation category, dependent on the number and type of grant applications received. 7 grants have been designated for the expansion category, and then 3 awards have been designated for the enhancement category. That being said, if there aren't enough applications that fall into a certain category, so for example, if we only receive 4 applications for the expansion category, the remaining awards for that category will be divided amongst the other 2 categories. So in total, there will be 20 grants awarded. Next slide, please. This grant is a 3-year grant for a total of 36 months and 3 12-month budget periods. The funds for this grant will be distributed in 3 different increments. The first distribution will take place on July 1st, 2024. And that will be for $500,000. The second distribution will take place on July 1st, 2025. That will be, excuse me, for $1 million distribution. And the final distribution will take place on July 1st, 2026, and that one will also be for $1 million. Next slide, please. In regards to grant eligibility, this grant is eligible to state governments, specifically state Medicaid agencies. This includes the District of Columbia and all U.S. territories. Any state Medicaid agency may apply. However, only one application can be submitted for a given state. Next slide, please. As I explained previously, there are 3 category designations that states will use to complete their application. While all grant recipients will have general activities they will be expected to complete, additional activities will be required depending on the application category the state selects. There are 3 categories that are available. So the first category would be the implementation of Medicaid SBS. The second category is the expansion of Medicaid SBS. And finally, the enhancement of Medicaid SBS. The next 6 slides will go into more detail regarding each of these categories, as well as providing some examples. Next slide, please. So category 1 is the implementation of Medicaid SBS. Applicants seeking funds to support implementation activities may include states that have yet to expand the coverage and billing of Medicaid and CHIP services provided in schools beyond that which is provided pursuant to a student's IEP. Proposals should specifically describe how the funds will be used and describe the issues that the funding will help resolve, including but not limited to the building out of school infrastructure for providing healthcare services, training, and assessment of needs to allow for the furnishing, billing, and documentation of Medicaid and CHIP SBS. Next slide, please. Category 2 would be the expansion of Medicaid SBS. Applicants seeking funds to support expansion activities may include states that have expanded the coverage and billing of Medicaid and CHIP services provided in schools beyond that which is provided pursuant to a student's IEP, to include at least the expansion of one enrolled provider rendering non-IEP services, again, such as a school nurse, or states that have expanded coverage in school-based setting for at least one additional non-IEP Medicaid service under the Medicaid or CHIP state plan for any IEP or non-IEP Medicaid or CHIP enrolled student. Next slide, please. So some examples of category 2, the expansion of Medicaid SBS, would be states that have included all Medicaid or CHIP coverable IEP services in their state plan, plus additional Medicaid coverage of allowable vaccine administration or fluoride varnish treatments provided to Medicaid or CHIP enrolled students would be included in this definition. Another activity would states that have only expanded billing of Medicaid and CHIP covered services provided to Medicaid or CHIP enrolled students pursuant to an IEP or a 504 plan. Next slide, please. So proposals should specifically describe how the funds will be used to describe the issues that the funding will help resolve, including but not limited to the expansion of free care in the state program, expanding provider qualifications of Medicaid or CHIP services provided in the schools, and or the expansion of the availability of services provided via telehealth delivery systems. Next slide, please. And then the third category, the enhancement of Medicaid SBS. Applicants seeking funds to support enhancement activities may include states that have expanded the coverage and billing of Medicaid and CHIP services provided in schools to include any Medicaid or CHIP covered services provided to a Medicaid or CHIP enrolled student, whether that service is provided pursuant to a student's IEP or under the federal free care policy, which means any allowable Medicaid or CHIP service provided to any Medicaid or CHIP enrolled students that are medically appropriate to be provided in a school by qualified providers under the Medicaid or CHIP state plan. Next slide, please. So proposals for the enhancement category should specifically describe how the funds will be used and describe the issues that the funding will help resolve, including the increased availability of mental health services, the removal of coordination barriers between schools and providers in the community, and the creation of school-based health clinics. Next slide, please. So now I'm going to get into the activities that are associated with this grant. As I explained previously, the majority of the activities discussed will be universal regardless of what category your state applies for. I will also be explaining the category-specific activities in later slides. For the general activities, all applications should include plans for completing the following activities. Applicants must conduct and provide a needs assessment of their Medicaid and CHIP SBS programs. Applicants must develop a stakeholder input process to help inform the needs assessment and gauge the success of plan initiatives. Applicants must identify specific infrastructure needs that would enable more effective and efficient billing of Medicaid and CHIP services in the schools. Next slide, please. Applicants must submit proposals describing how initiatives funded through the planning grant will be sustained in the immediate post-grant award period. So for the first 2 years after the grant funding has ended, again, planning for that. Applicants must participate / engage with the CMS Technical Assistance Center. The TA Center is actually another part of the Bipartisan Safer Communities Act. In partnership with the Department of Education, the TA Center was developed to provide guidance to both states and localities, including LEAs. So participation in that is important. Applicants must describe in detailed information related to the delivery of Medicaid and CHIP SBS in large rural and remote areas of the state. And applicants must include a methodology to keep an ongoing list of successes and challenges. And for the challenges, they must present action steps taken towards the resolution of the issue. Next slide, please. Applicants must present post-grant sustainability plans for the future of Medicaid and CHIP SBS program and the ongoing availability of Medicaid and CHIP services in the schools within the state, but describing long-term service goals. So where previously we were looking for like the immediate future, which would be that 2 years. For this one, we're wanting to know long-term goals of 5 years past the ending of the grant funding. And finally, applicants must present current procedures and proposed process improvements for statewide tracking, documenting, and maintaining Medicaid and CHIP service data. Along with completing these activities, all recipients will be required to participate in regular meetings with CMS and our contractors to discuss state strategies and implementation of state efforts. Next slide, please. Now I will be discussing the specific categories activities. So along with the general activities, the implementation category has one additional activity that will need to be planned for in the application. So that activity would be applicants must present plans for the collection of evidence of increased utilization and partnership or participation of new and existing local education agencies or LEA programs within the state. Next slide, please. For the expansion category, there are 2 additional activities that must be included in the application, and they are plans for or active submission of state plan amendment or a SPA to expand the coverage of Medicaid and CHIP services in the schools to the full scope of Medicaid and CHIP services versus single non-individuals with Disabilities Education Act or IDEA services. And then the second activity would be submissions must include detail of the current Medicaid and CHIP services that are covered in schools, details about whether services are IDEA only, or if the state covers more than the Medicaid and CHIP services that are required by a child's IEP must be included. Next slide, please. The enhancement category has 3 additional activities. The first activity would be applicants must provide a description of the current status of their behavioral health / mental health care services within the school setting. Applicants must also provide plans for increasing access to these services in the future. And finally, applicants must describe how they intend to increase equity of access to Medicaid services in schools for all children in the state, regardless of where that child resides. Next slide, please. There we go. In addition to providing plans for completing the required activities, applicants are encouraged to include information on current activities that relate to or will support the applicant's proposed activities, as well as help to inform CMS's review of the application. The projective narrative should also include information describing the following: staffing, state infrastructure, data sharing, data and claims reporting, and organizational structure. Next slide, please. In order for an application to be considered complete, all applicants must submit the following: standard forms, a cover letter, a project narrative, a budget narrative, business assessment of applicant organization, federally negotiated indirect cost rate agreement, if applicable, and a work plan and timeline. Please note that incomplete applications will not be reviewed or scored. Additionally, while a letter of intent is not required, it is recommended. All letters of intent should be submitted no later than February 23rd, 2024. Next slide, please. For the letters of intent, a letter of intent is recommended, but again, not required, and should include an expression of interest, including the proposed regions of participation, a brief description of the interested organization, and contact information, including the organization's street address and a contact person's name, position, email, and phone number. Letters of intent can be submitted to the SBS program team email, which would be Medicaid SBS Planning Grants with an S at cms.hhs.gov. And again, that due date would be February 23rd, 2024. Next slide, please. All applications must be submitted electronically and be received through the grants.gov website by March 25th, 2024 at 11:59 p.m. Eastern. Applications received after the date and time set forth above will not be reviewed or considered for award. Next slide, please. Other dates to kind of keep in mind. After all applications are received, they will be reviewed, and the recipients of the grants shall be announced in June of 2024. And again, the first distribution of the grant funds will take place on July 1st, 2024. Next slide, please. And finally, for additional resources, you can find the grant listed on the grant.gov website. If there are questions that you guys have, while we will open up for questions at the end of this presentation, you can always submit questions to the Medicaid SBS Planning Grant email address. And if you are looking for additional information about Medicaid SBS, you can find that on the Medicaid website under resources, and it's located in the Medicaid State Technical Assistance. Next slide, please. And now we will open it up to questions. And again, if you aren't able to get your question out today, please feel free to email us with questions, and we will definitely respond to that. Thank you, guys.
Thanks, Lydia. Jesse, would you like me to turn the controls back over to you?
Sure thing. And I think we have time for just one question, and then we'll go back to the rest of our panel. So just one question, if you'd like, I think, and then will you be able to answer some of these additional questions that are coming through?
Yeah, we can take a look at some of them, and if not, we can refer them to the SBS grants mailbox.
Okay, great. Thanks. So we'll get these to you afterwards. So can you just reiterate, what level of engagement do you want to see between state Medicaid agencies and LEAs?
I'm thinking we would like to see pretty close engagement. You know, a lot of times the services are going to occur, and the expansion of the availability of those services and really the success will come from states' engagement with their local education agencies. And so we'd like to see pretty close partnership. I'm hedging because I don't recall if we use a must or shall in the NOFO guidance document. So I apologize for that, but you know, that's a partnership that's really important for the success of really any school-based services program, and particularly these grant opportunities. So
Great. Well, thank you so much. I know there's so many questions that are coming through, and what we'll do is we'll pull these questions afterwards. We'll send them to you. We'll see what we're able to answer and follow up with people individually, or we can post them on our materials after the webinar. So thank you so much for joining us and for being here. We really appreciate this overview of the grants and your commitment to this important issue. So thank you so much to Lydia, Andrew, and to the whole CMS team for being here.
thank you for having us.
So now I'm going to turn it over to Laura Guerra-Cardes with the Center on Budget and Policy Priorities. Laura, thank you so much for being here and sharing some remarks with us today.
Yes, hi everyone. It's great to be with you all. As Jesse said, my name is Laura Guerra-Cardes. I'm the Director of State Medicaid Strategy at the Center on Budget and Policy Priorities. And before I came to work at this center, I worked for nearly 15 years at the Children's Defense Fund of Texas as a health advocate, helping lead healthcare coalitions and campaigns in the state. I am here to talk about how you can use state advocacy efforts to make a difference in securing these kinds of grant opportunities for your state. And to do that, I'm going to share my own experience of how, as a health advocate, I have gotten to work with school districts throughout my career, and the lessons that I can pull from my experience that I think apply to this new opportunity. So when I joined the Children's Defense Fund a mere 17 years ago, we had one main goal as an organization: to help children get enrolled in Medicaid and CHIP. And while we did a lot of important work in the policy arena, working in a conservative state like Texas, we knew that we could only go as quickly as our policy advocacy process allowed. But at the time, we had 1.2 million uninsured children in Texas. That was 22% of kids in the state, so more than 1 in every 5 kids. So we knew we needed to work outside the box if we were going to reach our goal. And in looking at the data, we knew that about half of the uninsured children in our state were already eligible but not enrolled in Medicaid and CHIP. So we decided to start working in communities with schools. To find a way, what we were really looking for was a systemic way to identify every uninsured child and connect them to coverage. Our work was started and inspired by the Dell Foundation's Insure a Kid initiative that worked with school districts to add a health coverage question on school enrollment forms that would then help you have a list of kids who were uninsured in a district. And that program was great, but we also decided to take it a step further and help communities and schools build the infrastructure to actually reach out to those uninsured children and help their families get their kids enrolled. As we did this work, we found that while health and education advocates came from different worlds, we speak the same language when it comes to supporting children's ability to thrive. And this mission resonated with all kinds of different folks we found in the education space, as I'm sure you're not surprised. But we worked often, we worked both top down and from the ground up. So we would work with school board members and superintendents who were interested, but often it was also the school nurse or the school health director that was the one that really pushed these ideas and initiatives to their entire school or their entire district. Over the course of a decade, we were able to work with over 25 school districts in Texas and about a dozen districts across the country in partnership with the American Association with School Administrators. And this work took partnerships. We worked with foundations to help provide funding for staffing support for schools. We worked with health plans also to secure some funds and help with enrollment. We worked with school administrator associations. With Medicaid, we received one of the CHIPRA grants, and then of course it took many health and education advocates across the board to pull this project off. So as I reflect on this work and what ultimately took me as a healthcare advocate to become pretty well versed in working with schools to keep children healthy and thriving, I see a few lessons that we can take to this current opportunity to expand Medicaid school-based services. The first two lessons are that we need to keep the ultimate goal in mind, and that this work takes partnerships. We need our kids to thrive, and doing so at times necessitates us stepping outside of our silos and comfort zones. These HHS grants are an incredible opportunity, and we just heard even necessary, to bring health and education advocates together to reduce barriers to the healthcare kids need to succeed in school, to help children enroll in coverage, and to bring much needed funds to schools. Healthcare advocates, of course, can bring the data and expertise on how health coverage impacts school and school attendance and school success and educational success. And they have the longstanding connections with the Medicaid agency. And education advocates have relationships with the education agency, standing with school administrators and school board associations, and the ability to organize within the education community. Lesson 2 is to orchestrate the big ask. Rally the partners you need, organize them, and make the ask from the strongest position that you can. For this grant, it could look like bringing a handful of school districts together from your state, along with the Association of School Administrators and Health Advocates, to have a meeting with the education agency and ask them to join you. Hopefully they're already attuned to this opportunity, but if not, to join you in making the ask and offering the partnership to the healthcare agency to make this grant possibility a reality in your state. So of course, to do this, you have to figure out the power dynamics around the issue. Who would make your most strategic partners? Who do you and those in your network have access to? Who do you need to reach to make your strongest ask? And lesson 3 is offer support for education. And we heard a little bit about this. To pull this off, it's really going to need support from all of these partners. And that makes it doubly important to build your partnerships early with these groups. My last just remark in closing is that it may feel like there is not much time to get all this work done, but sometimes pulling the right coalition together can take less time than you would imagine. When I was working at the state level, that CHIPRA opportunity for outreach grants came up, and we had about a month to pull a project together. In a matter of weeks, we were able to pull the 7 largest school districts in Texas together, secure a partnership with the Association of School Administrators, and get a partnership from the health agency for what was ultimately one of the $1 million grants awarded to states that we were able to bring to our state. And so from what I saw, what I see from the education and health advocacy world is that the partnerships and relationships with the right people are there when you look at our networks between us, and the interest is there. It's just a matter of organizing our power. And so from wherever you sit in this space, think about who you know and what you can organize to give your state a shot at this funding opportunity to help the kids in your state thrive. So that's the end of my remarks, and I'm passing it now to Jen Griffiths. Thank you.
Laura, and thanks to everyone just for the opportunity to share and just providing this space for the conversation. I do have some slides just to kind of walk through quickly. So Alaska we have not expanded school Medicaid services, and that's an important context you can go to the next slide. That's an important context just to ground us in. So just really quickly, the political context that we face when we're doing this work in Alaska We have a perceived lack of revenue, which just means that priorities are always an issue, and there's always a conversation about funding and how to make those decisions when it comes to moving forward with policies and programs. There is also a youth mental health crisis. This is across the country. Specifically in Alaska, we had a Department of Justice report that was released in December 2022 related to a lack of community services that was leading to a high use of residential treatment. That has triggered some intense conversations around the mental health space. Combined with just our educators constantly speaking out about the mental health concerns that they are experiencing within their classroom. So we're hearing this really from both sectors, from the health sector and from the education sector as well. And then finally, just underfunded public schools. Education funding is not sufficient to keep up with inflation. This has been a very intense conversation within our legislature for the past 2 sessions. Definitely it takes a lot of the space within our session. And so it's one of those pieces that we're navigating. It leads to really large class sizes, just exacerbates some of those challenges related to that mental health crisis. Next slide. So within that, our school Medicaid context is that school Medicaid is limited to IEP in our statute. So we know as a state, in order to access this expansion, we will have to have a statutory change. That's a pretty high bar for us to reach, and that definitely impacts the way we approach the situation. Because some states will only have to deal with regulatory changes. We're going to have to deal with a pretty significant statutory change. We also have really diverse school settings. We have large urban schools in Anchorage, and we have incredibly small schools out in rural Alaska that are only accessible by boat or by plane. So our diversity among our school settings is vast. We also have community providers that are currently providing services in schools, some great programs that we want to continue to support. As we're looking at this expansion, we're really looking at it as a both and. So how do we make sure that we're supporting the current pieces that exist? Next slide. So conversations around expanding school-based Medicaid have been happening in Alaska for several years, but last fall, Alaska Children's Trust decided to host a convening for stakeholders to really elevate the issue again, knowing what had happened with the Bipartisan Safer Communities Act and kind of where things were headed. We wanted to provide that space. So we had a large group of stakeholders at that initial meeting. We really worked then to pull together everyone that we could think of. We had school districts, tribal partners, state agency staff, legislators, advocacy organizations, community behavioral health providers, just a broad group of stakeholders. We had 3 presentations, just provided a lot of information. And then we had a follow-up survey and worked to have some follow-up conversations. Our goal was to keep talking and educating each other, and to really work to just hold that space for that conversation. We knew as advocates that we could only do so much. We needed the state agency to step in, or we needed a legislative champion because we had a statutory fix to really move this forward. So as I look at where we are in Alaska right now, facing this opportunity with this grant, and our agency with the state has said that they're interested in applying, we would not be in that position if we hadn't, as advocates, held space for that conversation and just really kept talking and bringing the issue to the forefront, even with all the other competing issues that were happening around us. Next slide. Another important aspect of our work and kind of getting to the place where we're even looking at applying at this grant and kind of taking that step is that we really worked to leverage the issues around us to get that attention. I mentioned we had the Department of Justice report. the school funding issues, social media and youth mental health. We've really leveraged those pieces. Other states may have different issues that are getting political movement. So as you're looking at this in your state, what is an issue that has political movement right now that you could leverage to help move school-based Medicaid forward? In the early childhood world, there's a lot of conversation about even early childhood mental health with the child care crisis. That transition from early childhood infant toddler supports into school age, there's some benefit there in looking at, what expanding school-based Medicaid could do. So there's a lot of opportunity to be able to leverage and make connections with other issues. So consider that. That's definitely been helpful to us in Alaska. And then next slide. The last piece that I wanted to share is just the importance of remembering that you're the experts in this space. This is a complex issue. We've heard this multiple times, and we need people from multiple stakeholder groups to share information. And that's been critical in Alaska, is just bringing in the experts and letting everybody share their expertise, listening and learning from each other, that cross-pollination across sectors. That's been very helpful as we've developed this group of stakeholders, and now are looking at the Department of Health utilizing that expertise and that knowledge in moving us forward with this grant process. So the next steps, we can go to the last slide, is just we're just looking at utilizing this grant as a bridge from the past to the future. We have a lot of expertise. We had a lot of work that was done, and now we're looking at using it to kind of put it into practice by taking advantage of this grant opportunity. We're really looking at a stakeholder-driven process, not just stakeholder engaged, but really utilizing that expertise on the ground to design a system that's going to work in our unique context in Alaska, and then just strengthening those partnerships. This is an opportunity to kind of model system transformation that's not only needed in this space, but is needed in all other child serving system spaces within our state and even across the country. So it's such a great opportunity to kind of work on strengthening those partnerships and modeling those relationships. So with that, I will pass it over to Emily.
Thanks, Jen. And I'm Emily Beauregard again, the Director of Kentucky Voices for Health. I will say, when Jen was talking about the political context in Alaska, it could have easily been Kentucky's. Our Medicaid context is very different at this point, and Medicaid in Kentucky decided to take the option to expand services to all Medicaid and CHIP enrolled students in 2019. And that was a time in my career as an advocate when we had a governor who was trying to end Medicaid expansion in Kentucky, and we spent 4 years fighting that. But this was an area where we were able to find alignment and work to support, this state plan amendment to open up Medicaid services in schools, which was a great step. But one thing that I have learned as an advocate over and over, kind of a perennial lesson that I take with me every day, is that implementation is just the beginning. You get something approved, and it's only as good as you implement it. And so this was approved right at the end or kind of middle of 2019. And we had another administration change. And then, of course, we followed that with the pandemic. And so I think the focus on school Medicaid was really diverted in a lot of ways. And there was also this sense of, well, we've done what we need to do to allow schools to build. Now it's up to the Kentucky Department of Education to take the reins and work with schools to make this happen. And because our schools were already doing IEP services and billing Medicaid for those services, I think the assumption was that this would be a relatively easy switch to just flip and get more services in schools. But there were a lot of reasons why that just hasn't been the case in Kentucky, and we really aren't anywhere near finished with the implementation. We haven't leveraged school Medicaid for all it's worth. So I'm very excited for the grant for that reason. and have a lot of ideas that we're planning on discussing with our Department for Medicaid. Our state is planning on applying. They're actually doing a survey now. So that stakeholder survey that was discussed is out. They're asking a lot of the right questions. And hopefully we're going to be getting a lot of good input right before it's due in March. It's a quick turnaround during our legislative session. But I will say, I mentioned this rule was reversed in 2019, the free care rule. And then we passed a bill in 2020 for school safety that included an unfunded mandate for schools to employ one mental health provider for every 250 students. The assumption again was school Medicaid is going to take care of it. We've had a nursing shortage. Less than half of our schools have a full-time nurse in their school. And we think that this again should be something that school Medicaid could help to change. But schools have been slow to adopt this and to really implement. And I think there are a few reasons for that. I sent in a data request before this webinar to just see exactly how many schools were participating and about how much they were billing. We have 171 school districts in Kentucky. 57 are participating right now, and they're only billing an average of $5,500 a year. So really barely, providing services or scratching the surface of what's needed. These services, though, the top services include psychotherapy and other behavioral health services and nursing. But contrast that with IEP services, which is much smaller, kind of population of students. And these schools are averaging about $56,000 a year in billing. So still relatively a small amount in Medicaid budget terms. But we know that we have a long way to go. And so I think that Kentucky's probably falling kind of squarely in the enhancement part of this grant. And there are lots of opportunities that I think we have to remove barriers to, schools being able to participate and take advantage of this. And particularly workforce shortages, I think, are part of the issue. But something really specific that we've identified, and I'd be curious to know if other states are also running into this, is that setting up the administrative rate for billing and doing these, what they call random moment time studies, they're based, at least in Kentucky, on the school schedule, which is just, a couple of shifts. So looking at services that should be provided after school, in the evenings, on weekends, just non-traditional hours, we're not able to bill for those right now. And that's a real impediment to, any sort of like pop-up vaccine clinics or, well child checks or, school physicals that would be sports physicals that families really need. And so these are some of the things that we've been learning in the last few years. And then there was an audit of IEP services that was from a few years ago now, but it resulted in some clawbacks. And so that had a real chilling effect on schools. They need more technical assistance in order to feel like they're going to get this right and not, risk losing money. I think that's a big part. And something else that we've learned is that schools right now are being required to have two consents, one consent to treat and one consent to bill. And the way that the consents are written, they're not in plain language. They're a little bit intimidating and kind of legalese. And I think that parents are less willing to kind of opt in because they don't necessarily understand what's involved, and they think maybe they'll be balance billed if Medicaid doesn't pay. And we know that's not the case, but that's the impression that I think the consent gives. So those are a few of the barriers that we've identified. There's also, the sharing of medical records or just care coordination and continuity of care between the providers in schools and the community, making sure that the MCOs are involved. Because the way Kentucky has done it, and I'm guessing some other states too, they're doing this fee for service so that the school is actually putting up the state match, and it's just a more administratively simple way of doing this. And yet that means that the MCOs who otherwise cover these kids aren't covering their care in schools, which creates just one other kind of level of complication, and it means that the data isn't being shared directly with the MCOs or with the community providers. So these are some of the things that I think having a grant that brings more stakeholders to the table and gives us an opportunity to really collaborate and focus more on some of these barriers now that we've had a few years of seeing, you know, how implementation went. I think these are some things that we're going to be able to accomplish together.
Emily, thank you so much, and Laura and Jen. I know we're up at the top of the hour, so we're not going to have time for questions, but I just want to reiterate everything you all said is so helpful. Thinking about how, you know, what you said about this grant opportunity really being a way to bring communities to the table, to bring people together, and that no matter what you're at, we're all, you know, no matter what phase or state we're in, we're all tasked with trying to make this program better, or get it started. And so just want to appreciate you all so much for the work that you've done in your state to lift this up and to work on behalf of kids and families, and for the advocacy that you do. So we'll have to come back together for another Q&A, because I think we could spend a lot of time kind of hashing out some of these issues. But thank you so much for lifting up this important opportunity. And with that, I will turn it over to Allison to close this out. Thank you all so much.
Thank you, Jesse, and thank you all so much for a great conversation today and so many excellent questions. As a reminder, if we did not get to your question, we'll be following up with you after the webinar. And so since we're at time, before we close out today, I just want to quickly note that in addition to today's recording and slides, we'll also be following up with you to share several resources that we hope you'll find helpful as you work to increase access to and funding for school-based health services in your state. So once again, thank you to our speakers, Lydia, Andrew, Laura, Jen, and Emily, for providing so much insight and great information during today's conversation. Please continue to follow us and stay connected to the Healthy Schools campaign via our social media networks and by going to our website, healthyschoolscampaign.org. And again, all resources will be sent to you as follow-up in the coming days. So, and then there's our contact information in case you want to get in touch with us after the call today. So again, thank you all for being here. We hope you enjoy the rest of your day.